Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon, Dr. Alfred Bonati. We have an incredible show lined up. We're going to get right to it. A new technology called Far-UVC that is highly successful at inactivating bacteria, viruses, and fungi in the air and on surfaces, and is transforming healthcare environments. Joining us to discuss is Wendy Walling, Business Development Director with Lit Thinking. Thank you for joining us, Wendy.
I'm so happy to be here. Thanks for having me.
Certainly. So we first featured you back in 2017. Can you tell us about the latest development in UV technology?
Yeah, so what we're doing at Lit Thinking is really we're at the cusp of what we would call next generation UVC technology. So UVC has been used for decades in healthcare environments and water, municipal water treatment and disinfection. A lot of people are familiar with UVA and UVB, which is produced by the sun. UVC is as well, but it doesn't break through our Earth's ozone layer. So we've been using it artificially for a long time to disinfect, different things. In healthcare, if you're familiar with it, they use UVC towers very frequently. It's a great technology because it rapidly inactivates bacteria, viruses, and pathogens, but it can't be used safely in occupied environments. Basically, it penetrates skin and eyes very quickly. So what's really changed with Far-UVC technology, it's still part of the UVC spectrum, which is germicidal, but the shorter wavelength means it can't penetrate skin and eyes. And that's what's really enabling its use today in occupied environments. And we're the reasons that pathogens spread. We are the source of pathogens, and in the built environment, hospitals and things, we have to get a control over that. And Far-UVC is now able to do that.
A lot of people get sick at the hospital. Sadly, can you explain what HIAs are?
Yeah, actually, it's HAI, so Healthcare Associated Infections.
I got it backwards.
Actually, I just returned from a major conference. It's called APIC, Association for Professionals in Infection Control. And Far-UVC was really the hot topic because it provides what they're describing as the holy grail of continuous air and surface decontamination. Environmental cleaning in healthcare can only go so far. And they know that, they can disinfect surfaces when they come in and do their cleaning and terminal cleaning. But the time to recontamination of these rooms is very rapid. So within 4 hours in an occupied room, Candida auris, MRSA, different pathogens, they completely take over the environment again. They just can't keep up. And that's where Far-UVC technology of what we're doing is bridging that gap. It's tackling the in-between time of actual manual disinfection. We don't intend to replace that, but we supplement it in a really significant way.
Now, commercial UVC has two categories. Can you explain the difference?
Yeah, so the traditional, what we would call the legacy technology, which is still in use, that's UVC at a wavelength of 254 nanometers. New York City water is disinfected with UVC 254 technology because it tackles what chlorine misses, because there's no pathogen that's not susceptible to UVC inactivation. Far-UVC is different. That's the 222 nanometer. And basically, it's a shorter wavelength. And like I said, it's still in the UVC spectrum, in the germicidal spectrum of UVC. So highly proven to be beneficial, but completely safe. And that's what's revolutionary about it. A lot more people are starting to recognize the benefits from a green technology as well. It's not adding additional chemicals into the space. It's a passive technology. It doesn't require any human intervention. And also, it's low energy as well. So basically, our fixtures run at 14 watts. So what that means is they can be running 24/7 in your building for about 6 cents a day in energy costs.
We're going to take a quick break. We'll be right back with Wendy Walling after this. You are watching American Medicine Today.
I went to Dr. Bonati and he went ahead and looked at my pictures. He told me, you have pain here, you have pain here. And I was like, yeah, absolutely. I'd been to others, but he was a doctor that didn't want to fillet my back open like a fish and do like open spine surgery because everybody else wanted to do that and I was not having it. The anesthesiologist who was working with me, I was like having a conversation with this guy and then I was watching on the monitor as Dr. Bonati is fixing my back. I really felt like I was in good hands.
Bonati succeeds where others fail. Welcome back to American Medicine. Today, we're continuing our discussion with Wendy Walling. We always hear UV, limit your exposure to UV. So you're saying this Far-UVC is safe?
It's proven to be safe. It physically can't penetrate the dead skin cell layer of our skin, nor the tear layer of our eyes, and that's what enables its use. Further to corroborate that is our fixtures are UL certified. So that means even if a 6'3" individual was, and to be clear, our devices, I'll show you what it looks like just so there's some context. So these are fixed. This is a UVC fixture. This is on. This is the excimer lamp that's emitting 222 energy right now. Completely safe, but it's designed to be installed in the ceiling like a candlelight.
Yeah, I was going to ask you that. How many of those are there per room, or you just need one?
Depending on the size of the room, they can cover up to 200 square feet, but like in an OR space, we would put one in per every 125 square feet, just because it's a more critical environment and we want to ensure that we're getting effective continuous room decontamination all the time. But, speaking of ORs as well, what's great about that is, it doesn't impact the room lighting. It doesn't, so no one even knows that it's on. It's less than 1 lumen of light. So it's kind of like this soft purple, almost like a nightlight feature that most people don't even realize is on.
And this is in the marketplace, right?
It is, yes. We're actually installed at Mount Sinai Hospital in New York City. We've been working with the VA. Our fixtures are in the Cleveland VA, and we're expanding that program as well.
If this sort of system had been around during COVID, do you think anything would have changed? Like, what would have changed?
Completely.
Yeah, absolutely. And I'm glad you brought that up, because right now we're dealing with this new variant, the Nimbus variant, the razor blade throat variant is what they're calling it. There's a Fast Company article that World Health data is showing that we've already had 128 deaths in the U.S. with this variant. It's airborne, it's that, and that's what we tackle best with Far-UVC. So you think about the indoor environment, people don't even know that they're sick sometimes, but we're continuously shedding germs. And this is knocking that down in real time all the time. So it could have changed things. And that's something I've been thinking about a lot, is that everybody was getting COVID fatigue. They didn't want to hear about it anymore when it went away. But here we are back again with a new variant. And we need to do things differently. Obviously, wiping down surfaces is, manual cleaning is important to do. But when you have an airborne virus, tackling it in the air in real time is critical. And that's the game changer.
The unit you just showed us is installed in the ceiling. Do you have anything that might fit something like fluorescent lights?
No, they're not.
Does it come in on?
It doesn't. So it's not intended to replace or be integrated with the lighting. It's just an additional, fixtures that go into the room. So they are for commercial facilities. They can be used in residential, but we don't sell into residential. But we're really focused on the commercial environments, whether it's healthcare, schools, offices, gyms, any public space like that.
All right. And where can people learn more?
Yeah, so they can come to our website. It's litthinking.com, LIT thinking.com. There's lots of information there, and I encourage your listeners to go and check it out. We'd love to work with you. We're really excited about the game-changing ability of this technology to make our indoor spaces safer.
All right. Well, Wendy Walling, thank you for being on the program, Business Development Director with Lit Thinking. Thank you for telling about this innovative technology.
Thanks so much.
Well, that's all the time we have for this segment. We'll have more after the break. You are watching American Medicine Today. Dwight is a lifelong truck driver from Michigan. He sits down with us just one day after his exclusive Bonati Spine Procedures.
Well, I'm living in Michigan. I've been a trucker, I guess, most of my life. It's coming up on 40 years. The pain, it started quite a while ago. The basis of the pains, I think, was trucking. When you're constantly getting bashed around by hitting rough roads and things like that, the pain basically took out my right leg. Where I had to leave work for a while. If I had to stand still, it was getting down to the point I never really timed it, but maybe 3 minutes or 5, and I had to sit down or lean on a counter It got to the point that I'd have to slide down the walls at home and finally had to get a walker.
Prior to coming to the Bonati Spine Institute, Dwight tried conservative treatments and even underwent surgery near his home.
And then the doctor, he goes through many procedures before operation trying to rule anything out and wait my time out for things that he'd try, like cortisone shots in the back. In 2016, after I had the operation, that took the pain out of the leg, so I was able to function and go back to work.
A couple of years passed, and Dwight noticed he was having trouble standing and walking again. Trying to avoid another surgery, he just dealt with the pain. Then
I guess it just kind of crept back in. If I went to the grocery store, I'd have to be leaning on the cart, or I'd hang down from the cart, kind of squatting, trying to pull the back apart, I guess, for the pain. But it was tough. It slowed me down at almost everything I had to do. And so then from that point, it just went on till it was just it's a daily thing. It's how much I could crunch the pain at the beginning of the day.
After learning about the Bonati Spine Institute, Dwight called and spoke with a patient advocate. Encouraged, he sent in his MRI for evaluation and was told that he was a good candidate for the targeted Bonati Spine Procedures.
After the x-rays, all I needed, because they had the newest MRI that I'd sent them, went into a room, doctor came in, he reviewed the x-rays from every level, and talked to me some about if I had any extremities that had pain, which it didn't, which I guess just centralized to the back. He has that little thing, and he shows you what's going on, and that's where I learned about it growing back around in there, and you had to let your nerve have its regular track back. And he was really good at explaining and showing me on a miniature scale skeleton.
The Bonati Spine Procedures are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with the surgeon. This twilight sedation is used to ensure the source of the pain is eliminated before the patient leaves the operating table.
I got to see some of it on the TV set. When I looked over to the side where the screen was, I saw like the hole where they had worked from, the things they were putting in there that I got to see, inside of me, I guess, or where they were. Then I get rolled into recovery. They asked me if I'd like something to eat or drink, and I'm, all ready to do that. So I asked for coffee, and a little bit later, just probably 5 minutes or so, they get you off the side of the bed and make sure you can walk.
When leaving the Bonati Spine Institute, guests are often surprised to learn they don't have to wear uncomfortable braces or endure weeks of physical therapy. Instead, they are told to simply walk a few times a day.
Yeah, the only therapy that I have to do is just walk.
Dwight tells us he's excited to get back to living life and recommends the Bonati Spine Institute to anyone living with neck or back pain.
The change in life from this is going to be a big difference. I mean, I'm only one day out of it, and from the very first surgery, I've noticed change for the good, much better. I'll be able to stand. I won't be having to stop activities, and got it all done. My wagon's fixed, so to speak. It was a blessing to me, and I can see that Dr. Bonati's blessed by Lord giving him the talent to do it, and him improving that with ideas, and him finding out what those were. If you're a person that has problem with neck or back pain, I would surely give them a call. The Bonati Institute. They do great work here, and experienced doctors have been doing it for many, many years, 20, 30.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome back to American Medicine Today. I'm alongside Dr. Bonati, who wants to talk about top questions that he hears by prospective patients when they reach out to the Bonati Spine Institute. What are people interested in finding out?
people have a lot of fear to be able to communicate with the physician because they don't really know what type of a problem is there and how they are going to face that problem. Large amount of patients, they come to the doctor late. They don't come in the beginning when the answer can be simple. They come after sometimes months, and I'm going to say years. So the areas that they are being affected, then they change, they degenerate, they become a different type of treatment is necessary in comparison to the one that you can do in the very beginning. The question is always, I have an accident around 10 years ago, and I didn't go to the emergency room. They didn't take any x-rays, and I had pain for around a week, and everything got better, and I'm okay. And the rest of my life, I live with some type of an ache on my back, and that ache on my back suddenly come back every so often, on and off and on and off. And today, I'm suffering of a lot of pain, and I know it's the pain that I had many years ago. That is practically the behavior of us humans. We believe that we're going to get better with time. And it's true that certain things are good, but if you wait too long, then the treatment or the response to treat that becomes now more aggressive. And the aggressivity depends who is the person who's seeing you. If you are seeing a chiropractor, well, they are going to crack your joints, and then they are going to do it more frequent till the time comes over that doesn't go away with that, and then you're going to go to another doctor. That period of time that they are manipulating your back or your neck ends creating a situation of the joints that they become now abnormal. And that abnormality ends with an arthritic problem. You can treat that depending who is the doctor who is going to see you, or more chiropractic treatment, or more medication if it is an internal medical doctor, or more physical therapy if it's a therapist, or a surgery if you end in the hands of an orthopedic surgeon or a neurosurgeon. Unfortunately, in medicine, each specialty or each individual who is going to treat this patient is going to do something, and that something is a type of mechanical behavior. And that mechanical behavior is an injury to the area that already has a problem. Take x-rays and take an MRI and give some pain medication to the patient is probably the minimal that you can do. Now, once you analyze something that is deteriorated and you have a degenerative, that escapes already from the hands of that individual, that doctor, and it goes to a higher trained individual. And if you end later with some type of a problem associated with arthritic changes in different joints, surgery is going to be necessary. They end deteriorating the joints, and they end creating what we call a spinal stenosis. And when you end with the spinal stenosis, in the early stages, as only a situation of numbness on the feet, then with time grows and goes up the calf, on the front of the leg, on the back of the leg, and the nerves are going to become now under pressure. That pressure provokes some pain, that's going to be associated with back pain, but that pressure provokes also deficit in performance. So you start to have weakness, you start to lose some out of the muscle bulk, and then the muscle bulk starts to become less powerful, and at the same time, the response of this muscle becomes delayed, is weak. So you try to stand up from the chair, you need to grab the furniture around you to pull with your arms to stand up. Then you walk with limps, or you walk with pain, or you practically cannot walk distances. And when you start to have that, then you start to use canes, you start to go walkers, or you start to have wheelchairs. That is practically the most dangerous question that I have in my practice, and I need to go through this type of a talk to a patient because I need to retrieve the injury initially, and usually is 40 years behind.
It's sad that they're afraid to talk to doctors about those problems, and they try over-the-counter medications, which also wreaks havoc on the body. Then when they finally reach out to a surgeon like you, you're looking at everything that's compounded over those decades. So be your own best advocate and make sure you look out for you. That's all the time we have for this episode of American Medicine Today. If you're interested in seeing previous episodes, add American Medicine Today to your favorite streaming devices. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.